Colorado's COVID vaccination rate increases. One of the most common questions is, will we need a booster? And if so, when?
Tonight, we have learned that could happen this fall, and it might not matter which vaccine you've already had. The focus right now is getting more people vaccinated in this round. 43% of Coloradans are fully vaccinated. 53% have received at least one dose. Today, Dr. Anthony Fauci testified during a Senate hearing. Fauci says months of research has led him to believe boosters will be needed. Health experts in Colorado saw this coming. They're already getting a plan together. Andrea Flores at UCHealth in Aurora tonight. Andrea, you have some new information on how a booster program will work.
CDPHE says they're looking into whether a booster shot will be needed, and they tell me they're starting to plan for that phase of the vaccination response. And many of the earliest vaccination patients, including healthcare workers, are now at that 6-month mark. And UCHealth tells me they're looking into research and starting to plan for fall.
Right now, we're doing great, but we can still do better.
With vaccination rates on the rise in Colorado, UCHealth is looking ahead to a potential COVID booster.
Other countries are having huge surges, and the need for them to get even just one vaccine probably trumps any kind of need for a booster at this point. That obviously can change on a dime.
Director of Infection Prevention, Dr. Michelle Barron, says a recent immunization hearing addressed the safety of getting a booster and another vaccine like the flu shot at the same time.
There is now sufficient evidence to suggest that if you give them at the same time, there's no risk or no concern that you're going to have something happen.
She says another study out of the UK is trying to figure out if different COVID vaccines can be mixed and matched if a booster is needed.
It was the combination of J&J with Moderna or Pfizer. There seemed to be more people that had side effects after that second dose.
As research on a booster continues, Dr. Barron says the first priority is making sure people get the vaccine.
Get your vaccination. If we need boosters, we will work through those processes when we need to.
Dr. Barron tells me the biggest issue right now that they're facing is figuring out if mixing and matching could change your antibody response for better or for worse. UCHealth expects to get more information on that research in the coming weeks. Reporting live in Aurora tonight, I'm Andrea Flores covering Colorado First.